I'm Anil Gorkhaly, working for eye care since last 18 years. We receive 5 patients, one dad, 4 sons in our hospitals with a cataract. And then we are so really surprised how it happens in a family. All the 4 sons, including a father, got the cataract. The father got operated first and then 4 children. And father's vision outcome was average result, but he was so happy with the result. 2 sons were during that time more than 12 years old. So our surgeons also operated them in their eyes. They are by birth they are cataract and then they couldn't see. But in the congenital cataract, the more you do the surgery in early stage, the better the chances of good vision.
Yeah.
But they are almost 12 plus, they got their vision back to some extent. And then now both of them are went to India for work. That is very good for their family income. And remaining two, the youngest one also who's operated in the cataract in their eyes, they are very good vision. They got a very good vision because they were quite young at that time. And then both of them are studying. 6 months back I met both of them and they are happy with the results of eye care. And then in their education also they are doing very good. So that is my very happy moment when I am now sharing with my audience. One of the interesting things to tell about Nepal is eye care system of Nepal is basically our Nepalese government do not support much in the eye health.
Right.
Though they support in other healthcare, but eye care is still left to the NGO sectors. Mostly we do not have infrastructure for anything. So road infrastructure, I mean to say about the roads, I mean to say about the electricities, basic things. And then in lack of this kind of infrastructure, to carry the eye care systems, to carry anything to those populations, those community is very difficult. And our geographical terrain is very difficult. So we have a flat land of around 15%. Rest all are the high hills and the mountains. Carry any of the eye care activities to those areas is we have to depend upon air, or we have to transport it by a porter, which is really costly, or we have to walk. Nowadays in Nepal, even in Kathmandu, the capital city, in the summertime when it's a peak dry seasons, we do not have electricity in a day around 16 hours to 18 hours. So all the equipment, how we run, how we depend upon a diesel generator, it will be again the costly things. So those are the problems we face right now. If I have to say about the eye diseases in Nepal, so 70% things are cataract. But one of the main causes could be due to the malnutrition, poor hygiene, and the ultraviolet rays that we get it in our countries, in our subcontinent. But basically the cataract covers a larger portions of the eye disease, and then following a refractive error, diabetic retinopathy, and then the glaucoma. So these are the things. You asked about the patient visiting our hospitals. So there are many types of patients. In early days, most of the patients, they are from a poor economic background who cannot afford to pay. So we started our service providing them who cannot pay. Now we have two type of patients, one who can pay, the other one who cannot pay. And then who can pay is we are using as a cross subsidy to who cannot afford to pay. Service wise, we provide them equally good services. Around 2.3 million people have already got benefited from our clinical services, and out of that around 250,000 patients got the surgical services from our hospital, from our eye camps, from our screening camps. We have already trained around 23 ophthalmologists to become eye surgeons. We have almost supported 250 ophthalmic assistant who we consider as a backbone of the eye care system of Nepal. And I like to add it that out of 14 eye hospitals in Nepal, we have constructed with the Dutch support 2 big eye hospitals, and which is excellently running well.